Today we are going to talk about gastritis, which is a common complaint by the patients. Gastritis is a wide term that we use for a lot of pains in the abdomen, in the upper abdomen. Abdomen is the area in the top of our tummy. Mainly if you try to identify what gastritis is the inflammation or irritation of the lining of the stomach. And in addition, sometimes you can have reflux, that is food and gas in the stomach coming up into your throat. So this is a symptom called reflux disease. With change of lifestyle and poor dietary habits and stresses in life, a lot of people have gastritis and reflux disease in the community. What are the symptoms of gastritis? As I said before, gastritis can manifest as abdominal pain, which is upper abdominal pain, or you can have food, gas, which is formed in the stomach coming up your throat, sometimes after meals or even when you bend down, sleep, etc. And also, sometimes these pains can be associated with meals. Sometimes these pains might be relieved with meals, and especially if you have a stressful life, you will realize that some of the events in your life can trigger this kind of abdominal pain. Sometimes, even though gastritis is relatively a harmless illness, it can cause a lot of problems with our general day-to-day life, especially like if you think of work-related things, studies, and your general day-to-day well-being. It might affect your general lifestyle. It is important that if you have this kind of symptoms, and if the visit to a GP has not settled your symptoms, it's important that you visit a specialist in this regard and get proper treatment and investigations. So if your symptoms do not subside with medication and lifestyle change, they might ask you to take additional tests like an endoscopy. And the second important thing about investigating gastritis is, because stomach has other organs as well, we have to make sure that the symptoms you feel are directly coming from the stomach and not because of any other illness. So if you pay attention to these symptoms, you might also avoid missing a more dangerous disease in the process. So if you have any of these symptoms, please go and see a specialist who will help you to manage these symptoms and try to arrive at a diagnosis. Thank you.